If you have a father, mother, sister, or brother that has type 2 diabetes, your risk of developing this nasty but avoidable disease is up to 4 times more than someone without a diabetic relative. Do you know what symptoms to watch for that may mean you have prediabetes or diabetes also? Today, we're going to review the symptoms of type 2 diabetes you need to be aware of that may signal it's time for you to go to the doctor. Good morning, health minded people. I'm Dr. Snow, and I teach you to stay as healthy as possible to keep you on the fewest medications as necessary. If you have a parent or sibling that has type 2 diabetes, you may have watched them struggle to keep their blood sugar under control so that they can avoid the nasty complications that it can cause. But do you know what symptoms may mean that you too are developing this disease? A first clue that you may have diabetes is having to urinate frequently. The reason this occurs is because your body is trying to get rid of all that excess sugar in your blood, and since it can't get the sugar into your cells, it has to excrete it through the kidneys. Urine is made up mostly of water, so with the sugar goes a lot of water, leaving you dehydrated. Oh, and here's a fun fact. Because there is so much sugar in a diabetic patient's urine, their urine is sweet. Before we had blood glucose tests or urine dip tests, doctors would diagnose diabetes mellitus by tasting the patient's urine. Aren't you glad you weren't a doctor before 1841? If you're learning something new from this video, please press that like button and consider subscribing to my channel. Another common but easily overlooked symptom is increased thirst. Horrible, excessive, there's not enough water on the planet thirst. This thirst is because of the dehydration caused by the frequent urination. If you're alternating between being in the bathroom and drinking gallons of water, it's time to see the doctor. Other symptoms that may be your body trying to tell you that you have diabetes include excessive hunger because of insulin resistance. The glucose in your bloodstream can't get into the cells, and your cells are literally starving. Weight loss may occur when you aren't trying because your cells can't get sugar, the main source of energy, and they start burning fat and muscle in order to keep you alive. If you suddenly lose weight without trying, see your doctor. Being tired all of the time is also caused because your cells can't get any energy and because high blood sugar can disrupt your normal sleep cycle. So you're exhausted but can't sleep. Irritability, sudden changes in vision, frequent yeast infections in women, and slow wound healing are all warning signs that it's time to see the doctor. If you are experiencing any of these symptoms, especially if they come on quickly, please go see your doctor as soon as possible. And if you would like to hear about my friend John Colette's journey to reverse his type 2 diabetes, watch this video next. Thank you for joining me today to learn about the symptoms of type 2 diabetes so you can recognize them quickly and take care of you. Stay healthy. Pay attention to what your body is trying to tell you. And have a blessed week.